am going to talk about the diseases which are prevalent during the monsoon. As the monsoon comes, we all are actually very happy to because we get a relief from the summer. But with the drops of the rains, there comes a lot of infections. There are a lot of viruses, bacteria, parasite, vector-borne diseases that come in play, and they give rise to a lot of diseases. The diseases are also because of the humidity. So there are certain fungal infections of the skin which we see during the monsoon season. So I'm going to discuss each one of them, how to identify them, and when to contact your doctor, and what we can do to prevent it. So the various causes of fever is dengue, malaria, chikungunya, viral fever. Viral fever can be other coronaviruses other than COVID, influenza, respiratory syncytial virus, etc. There can be hepatitis A, most commonly that is seen, and typhoid, cholera, diarrhea, leptospira. And I would like to tell you that please don't ignore any fever which is more than 3 weeks duration. It is not a simple fever. It definitely has some important cause and it needs to be investigated. But these are the fevers that we see during the monsoon season. And I'm going to talk about each one of them one by one. So coming to dengue, which is very prevalent, one gets a high-grade fever of around 101 to 105 degrees Fahrenheit. There is severe headache. A person is not able to sleep, sit. They are very restless because of the headache. There is a lot of body ache. There is backache, lower backache. The backache and the joint pains are so severe that this fever, the dengue fever, is also called as bone-breaking fever. Fever if you take paracetamol, it comes down. One has to even take a higher dose of paracetamol, and fever comes back again in 5 to 6 hours. At times, we have to give a higher dose up from every 5 hourly or 6 hours. But we need to understand that fever for paracetamol maximum dose is 4 grams in 24 hours. So we should not just keep on popping in paracetamol. It is important we know your stores and we do not exceed the toxic limit of paracetamol. The flushed skin is commonly seen with dengue fever, and there are measles-like rash, which is usually seen around 450 after starting of the fever. There may be a bleeding from nose and gums, but that again happens when the platelets start to fall after the 5th day of fever. To tell you, the typical dengue pattern is that for first 4 to 5 days, you have high-grade fever, and it is very debilitating for the patient, the family, because the fever keeps coming back and it is very painful. The body aches are severe. There is also pain behind the eyes. When the eyes are moved, then there is a pain. But at this time, generally, people should not come to the hospital for admission. Yes, for the consultation, it is fine. But what happens is the platelets start to fall on the fifth day of the fever. That is when one requires a close monitoring. That is when the complications are likely to occur. There are certain warning signs of the dengue fever, which are in the form of a lot of vomitings, abdominal pain, dizziness, there is breathlessness, severe abdominal pain. If all this is there, and when you're monitoring a platelet, if your platelet count is less than 40,000, that's when one should get admitted. Other viral fevers are like common cold, and they present with mild headache, they feel feverish, or there may be a mild grade fever. And if it is influenza, the fever may be moderate grade to high grade also. Other viral illnesses present with nasal congestion. There can be a sore throat, which will get better in 1 or 2 days. Patient feels cold, but there are no chills and dryness. So that means the body is not shaking while the patient is having fever, and that doesn't require any blankets or any quilts when the patient is developing fever. It lasts for 2 to 3 days and it gets better. But I would like to remind you, the COVID is still around. It hasn't gone. It is often confusing with the symptoms, but if you have these symptoms lasting and if you have some loss of smell and all that, please get your COVID also tested. Other common disease that we see during monsoon is diarrhea. This is because of consumption of unhygienic food and water. And however careful one is, diarrhea is highly treatable and avoidable sickness. So please understand that, if there is diarrhea, you should not wait and take the medical attention immediately. The diarrhea are of two types, acute diarrhea and chronic diarrhea. Acute diarrhea is when the patient suddenly develops diarrhea and there are multiple episodes of loose motions and the patient is very sick, they feel dehydrated. And chronic diarrhea is something which is going on for last more than 2 weeks, since more than 2 weeks, and it is 3 to 4 to 5 to 6 diarrheal episodes, and then that again require different kind of investigation, and there are various causes of chronic diarrhea as well. The symptoms are abdominal pain, cramps, there is bloating of the abdomen, the patient feels nauseous, there may or may not be vomitings, there may or may not be fever, and there can be blood in stool. Blood in stool is a sign of serious infection. It should not be ignored. It is usually associated with a lot of abdominal pain, and this are usually this is dysentery, and this requires oral or at times even IV antibiotics. So if you have blood in stool, please do not pop in over-the-counter drugs, and please report to your doctor and seek their attention and prescription. Cholera is also a form of a diarrhea. This is again by consuming contaminated food and drink, and it is one of the several diseases which spreads because of the poor sanitation and hygiene. So it is seen usually in the people who are eating from the roadside vendor, or people who are living in a very busy area where the hygiene is not very good. Cholera can be debilitating, one, because it has an uncontrolled watery diarrhea. So at times the person is not able to come out of the washroom because they are uncontrolled, they soil their clothes, and the diarrhea is rice water stool. It is typically white in color, it is watery. There may also be associated vomiting, and the patient becomes dehydrated very fast. So there are symptoms of dehydration like dry mouth, there may be low blood pressure, excessive thirst, muscle cramps, rapid heart rate, loss of skin elasticity, and there will be sunken eyes, and there will be low blood pressure, yes, of course. So these are the signs, and although we do not see cholera very often, but then we do see during each monsoon season, we do see 3-4 odd cases. So that means this virus, this bacteria is still prevalent, and one has to be very careful when one develops this kind of uncontrolled diarrhea, and especially when the stool is watery and rice water stool. Typhoid, it is again caused by having contaminated water or food. This is caused by a bacteria called Salmonella typhi and paratyphi. The fever is mild to high grade. The fever may also be because of with the chills and rigor. That means there will be a lot of shivering, and it is a high grade fever. Most of the time it is a very high grade fever. There is loss of appetite. Person doesn't feel like eating. There is vomiting and diarrhea. The diarrhea may not be as severe, but there will be increased frequency of passing stool. Vomitings may or may not be there. There can be abdominal pain. And this disease actually has a vaccine, and it is a preventable disease. One first line of prevention is by not having any food which has a potential to be contaminated, and one should drink clean water. So also one should take care that if the help who's working at you or cooking at your place or is cooking for you, if has any of such symptoms, should be treated immediately. Because if that person who's infected cooks a food for you, there are chances of infection being transmitted. So not only you yourself, but person who's working at your house in kitchen should also be free from infection, and then there are chances, if not, then there are chances of the typhoid getting transmitted from one person to other. Other most common cause that we see during monsoon is malaria. As the monsoon comes, the mosquito get a breeding site and they are out in larger number, and they spread the various diseases. This is also a vector-borne disease. As the dengue is a vector-borne disease, malaria is also a vector-borne disease. What is a vector-borne disease? Vector-borne disease is something which is not transmitted directly. The virus is not directly coming to a human being. It is through a third party. I mean, in that case, here it will be a mosquito. Which will bite a person who's infected, will have an infected blood, and then if bites a person who's non-infected, then they deposit that infected blood into the person, and then that person, it gets absorbed, and then there is fever with chills and rigors. It has a very typical fever with chills and rigors. The rigors are very strong. One typically requires 4 to 5 blankets of quilts, and because the chills are so severe. And fever is not continuous, especially in malaria. It has a circadian rhythm. That means there can be fever at least once in 24 hours, twice in 24 hours, once in 48 hours, or 72 hours. So this is called as fever in circadian rhythm. So when one tries to tries to contact a person on a doctor on a WhatsApp and says, I'm having fever since 2 days and I do have body aches, that one person considers this as a normal viral fever. That's why, even if it is a simple fever, it is important to visit your doctor to understand the pattern of the fever, and the doctor will take history and will tell you what are the tests that is required, and will have a presumptive diagnosis based on the symptoms and signs, which is not possible on WhatsApp message prescription. So I would say that it should not be encouraged. If one is not able to go to a doctor, it is advisable to take a teleconsultation. So coming back to the malaria, fever is not continuous, is in circadian rhythm. There is nausea and vomiting. There may be mild jaundice. There is headache, and if there are 4 types of actually malaria which are common, and this is malaria because of falciparum, because of Plasmodium vivax, because of Plasmodium ovale, and malaria. So these are the 4 types of parasitic infection which are common, and they have a different pattern. And out of them, if it is a malaria because of the falciparum, then there are chances of cerebral malaria. That means the meninges get involved and patient even can get seizures, loss of consciousness. We of course do not see this often these days, but then still this is prevalent in few parts of country and is especially seen in the monsoon season. So if you have any headache, jaundice or fever with chills and rigors, please visit your doctor. Another vector-borne disease is chikungunya. Chikungunya presents with a very high-grade fever. There are severe debilitating joint pains. The pain is so much that person is not able to walk. A patient even comes on a wheelchair. So these kind of joint pains are very typical to chikungunya. There is associated body ache. The pain is so much that the person is unable to move. Pain and fever actually responds to painkiller. It is debilitating but not life-threatening. So, and the joint pains, once the fever is subsided, joint pains may persist for a long time. So what happens is that when you have this kind of a fever, it responds to the painkillers or non-steroidal anti-inflammatory drug. But then when one has a tendency to pop in all antibiotics for no reason, then it is not a good habit to take it for a viral or a rickettsial fever or a vector-borne fever where they have no role. So chikungunya as such has a diagnosis made on a blood test. There is a PCR available for chikungunya and there are serological tests which are available. They have to be done on a particular day, which your doctor will tell you. But if you have this kind of fever with severe joint pains, first thing you must do is take a paracetamol and stick to paracetamol till you are able to visit your doctor. Hepatitis A is caused by a virus that results in inflammation of the liver. It is a vaccine preventable disease. So it is important that one is aware of the vaccines which are available. What are the vaccines preventable disease? And it is advised to take these vaccines and visit your doctor to know when you have to take the vaccine. Poor sanitation and hygienic eating habits and water and food contamination can cause the liver dysfunction because of the hepatitis A. Symptoms are there is high colored urine or yellow colored urine. There are yellow eyes. First thing that changes or the change one can notice is in the urine, and it is yellow colored urine that one passes, and the eyes gradually become yellow. There is abdominal pain. There is generalized weakness. There is severe loss of appetite, and there is vomiting. So because the person is not eating, the weakness is severe and there is at times vomiting. So this actually takes a very long time. First, the bilirubin goes on increasing, or at least for 7 to 8 days, and then gradually it falls. So this takes a long time to recover, and at times when the jaundice is severe. But this, again, as I told you, is a preventable disease. One, by taking care of the hygiene, and two, by taking a vaccine. So it is important that you know about the vaccine preventable disease. Also, this is again common in monsoon season, but it is, yes, preventable. This is scrub typhus is a rickettsial fever. It is spread by a chigger bite. Chigger is actually a mite which is present on the pets. So if you have pets at your home, make sure that they get the deworming in consultation with the veterinary doctor. And there's otherwise the chigger that are available, they are there, or the mites, they are there around the pets. Or if you have had any trip in the hills or in the jungles, then again, these chiggers are very commonly found there. And then if they bite you, then there can be a scrub typhus. How to identify them is, this is what you see here. This is known as eschar. This is a black colored patch that you will see where there is a bite. So this when we have fever which is long standing, is not responding, and the initial test for other infections are negative, then we look at the whole body and look for any eschar. This is quite diagnostic. Fever is moderate to high grade. Headache is mild. There are congested eyes. There may be mild jaundice and may have diarrhea and vomiting. So there are certain tests which are done for the scrub typhus with a good index of suspicion, and it is a treatable disease. But yes, if it gets complicated, it can even lead you to the ICU. So it is important to again take a medical attention at the right time. COVID-19, all of us know about it. Though it is not prevalent right now, but then it has not gone. We do see on and off few cases here and there, and we all know the common symptoms of COVID-19. And I would not actually go through each one of them again because everyone is well versed with it. Now, what do we do to prevent this disease? actually what I have discussed here, all these diseases are preventable, then, and that's a good news. So how do we prevent them? Always carry an umbrella or a raincoat to avoid getting wet in the rain. So when you are not getting wet in the rain, you are not likely to have any fever because the change in environment and the virus infections that you see. Dry yourself quickly if you get wet and stay warm. Stay hydrated. See, but during monsoon, one tends to have a lot of sweating because of the high humidity, and there is dehydration. So it is very important to stay hydrated, have frequent adequate liquids, although your thirst might be reduced in the rainy season. Use mosquito repellent creams when you step outside. Use mosquito repellents in home. Keep your surroundings clean, especially check for the water, stagnant water in and around your house. And if it is there, please throw it. If there you have cooler at your place, then spray some oil over the water in the cooler so that it doesn't become a spot for breeding of mosquitoes. Drink boiled or filtered water or RO water so that you don't get these waterborne diseases. Eat home cooked food, nutritious food. Eating outside food which is not covered is actually an invitation to a lot of diseases. So please take care of this. Follow hygienic habits. Wash your hands frequently, at least especially before you have your meal. Get vaccinated and avoid contact with the infected person. So out of the diseases that we have discussed, hepatitis A has a vaccine and it is preventable, and typhoid has a vaccine and it is prevented by them. Take a precautionary flu shot. Influenza is also preventable and you can take a flu shot which is repeated every year along with the COVID shot, which I think all of us have taken. Always wear a mask when you're going in a public space, especially, and because to avoid any airborne infections. Take vitamins and supplements, especially when you are deficient in vitamin D and vitamin B2. And yes, the masks have not gone away. You can wear a mask when you go out and prevent yourself from any airborne disease. Coming to the diagnosis and the treatment of such diseases, we first of all, as I have been reiterating again and again, that seek medical consultation. Teleconsultation, if you are not able to go, don't assume and self-diagnose, don't Google. Google is the most misleading thing that we see openly. Delay in diagnosis will delay the medical intervention and will delay the time to recovery. So if you are having any issue, any fever or symptoms that I have described here, please seek a medical attention. Either you go or book a teleconsult. Self-treatment again can worsen a disease, so do not pop in any antibiotic without advice from a doctor, because it will promote antibiotic resistance. So for the viral fever where the antibiotic is of no use, please don't use antibiotic. Don't use WhatsApp text messages for consultation. There are very, very high chances of errors. I can tell you wherever we have been providing and the patient doesn't get better, and when they come back to us, it is totally a different picture that we get to understand. And so one, that a patient feels that we have taken a consultation, we'll get better. There is a frustration that the person is not getting better, and there is a frustration to doctor as well, that why did the patient choose to take a WhatsApp message consultation and not come, and has wasted these important days for the diagnosis and the specific treatment. So again, it is advisable to seek medical attention in a right form. Avoid text messages and WhatsApp messages if you have any of the symptoms of monsoon diseases. To conclude, I will say, because of the lack of sunlight and humid, there may be several monsoon diseases, and there may be breeding seasons for the lot of vectors or the mosquitoes which can give you illnesses. There is in the monsoon air, because the air is not flowing, there is a stagnation of the air, so there are chances of spreading the infection really fast in monsoon, the viral illnesses, the monsoon season, and so are the diseases. I would again say the prevention is always better than cure, so protected and avoid monsoon diseases. Pregnant women, young children, and infants are especially vulnerable to infectious diseases, and they should be more careful. Also, the people who have comorbidities, who have undergone transplant, senior citizens, you should please take care of yourselves and avoid, because if one gets all these diseases, then this population is more vulnerable to complication and delayed recovery. So it is important that this population knows what is the vaccination, how can we prevent this disease, and make your behavior such that there are less chances of you getting the disease. So we have to reduce the chances of getting the disease itself. Thank you, and I'm open to any questions if you have. So the question is that please provide information on the conjunctivitis symptoms and prevention. So yes, there is a lot of eye flu going on at present. Conjunctivitis is going on. So the conjunctivitis, what is going on at present is a viral conjunctivitis. It spreads through the droplets. Like, if you touch your eyes and then you touch any object and someone else touches that object, then that person touches or rubs the eyes and then the person gets it. So that way it is actually communicable with the touch, and so the eyes, there'll be hurt, it will hurt, the eyes will hurt, there'll be pain, there'll be swelling of the eyelids, there'll be mild redness, there'll be watery discharge, or there can be a yellow discharge also, especially when you get up. There may be stickiness in the eye, and when you get up, probably you are not open to, your eyelids are stuck together and you're not open to, not able to open the eyes. It is advisable to keep your eyes clean. Wash your eyes with the clean water, not your tap water, but the clean water. So filtered water, boiled and cool water is something one should use for washing your eyes, and again seek medical attention. It lasts for 3 to 4 days, and it is advisable to take a medical attention again, because you don't know what kind of, it is conjunctivitis, but then there are cornea and other part of the eye which should not get infected. So it is advisable again to seek a medical attention. Frequently wash your hands so that you do not transfer the infection to someone else. Other question is, what are the symptoms of typhoid? I had mentioned it, but I would like to repeat it, that there is fever, high grade with chills and rigors, there is loss of appetite, there may be nausea, vomiting, diarrhea, and it is a long-standing fever, and person feels very sick. So these are the common symptoms of typhoid. Unfortunately, at times the diagnosis get delayed in typhoid, because initially all the symptoms of the fever are usually the same, all the infections are usually same. So it is better to rule out all other diseases which can be diagnosed in early part of the fever, and based on the ruling out, or based on the sending the investigation at the initial stage, typhoid can be diagnosed. How harmful is the rainwater per se when it comes to spreading virus and bacteria during? So yes, it is. See, if it is, for example, someone is having a viral fever, and then there is a stagnant water or a flowing rainwater which one other person is passing through it, then there are chances that the other person will also get it, who comes in contact with a contaminated rainwater. For that matter, even the swimming pool is a way to transmit viral infections, where there are chances, if it is a very busy pool and there is the chlorination and the change in water is not happening, there are chances of spreading a viral infection. So a stagnant water or a flowing contaminated rainwater can definitely spread infections. Other question is, when we go for trekking or outdoor activities, especially in a hilly area in monsoon, what are the basic medicine we can keep with us? Because getting sick in a hilly area when trekking is really bad. Yes, you are right. If you are going on a hilly area and trekking, there is, I mean, you do not get any medical attention or medical facility where you can visit. So it can be really bad. First and foremost, that you should be hydrated, well hydrated. You should be using a mosquito repellent when you go out. You should be using a cap and cover yourself, cover yourself well. You should be use and cover yourself well, and you should be taking the medicines like paracetamol, something like cetirizine if you get any runny nose, cough, some cough syrup. There you can also take a probiotic with you if you get any diarrhea. I can understand that you may not get a filtered water and or bottled water while you are trekking. It is advisable that when you wait at the base camp or wherever you stop, that you fill in all your bottles with the clean water so that you do not get sick. I wouldn't recommend to take you any antibiotic because this will be just popping it for without any diagnosis. You can also take some painkillers. You can take something for acidity when you are trekking. The RO water and purifiers are good enough. Yes, RO water also has different kind of filters to filter out. But yes, in general, they are good enough for filtering out viruses and bacteria. Yes. How to prevent stomach infection in monsoon? What to avoid, especially during the monsoon? So first thing is that even if you eat out with eat the things which are completely cooked. For example, if you're having a tea or if you're having a samosa, it is okay, but do not have a chutney. So that's what is not cooked. Do not have anything which is not cooked. So do not have salad, do not have fruits from outside, do not have any sauces from outside, do not have any open yogurt from outside. All these things are the means where you can get infection. And do not eat something which is uncovered and it's not clean. How a layman can identify, differentiate a bacterial infection vis-a-vis viral infection? It is difficult for a layman to differentiate. In fact, at times even the doctors require investigation to say that it may be bacterial or viral. Yes, there are certain symptoms also which may which can differentiate, but then it is better to go to a doctor to have this differentiation and not pump in an antibiotic on your own. Is brain fever same as cerebral? So brain in medical term is also known as cerebral or cerebrum. So so actually brain fever, I would say that there are three kind of things. There is meningitis, there is encephalitis, there is cerebritis. All these kind of infections can be labeled as brain fever or cerebral fever in layman's term. So, but then there are various form of infections which can give rise to this brain fever or cerebral fever. How to know when a fever is getting serious and needing immediate medical intervention? So any fever which is lasting for more than 2 days and is not responding to the paracetamol or your symptoms are worsening should have a medical attention. A fever which is in 1 or 2 days and is mild grade fever, responds to paracetamol associated with simple body aches, headache. You can just use paracetamol and wait. Do not pop in antibiotic. But if it is the fever is high, not responding to the paracetamol, you are getting additional symptoms in the form of cough, which is very bad, diarrhea, vomiting, then you should go to a doctor. So I think that's all I had to answer in terms of your questions. And I would say that please take care of yourself, vaccinate yourself against hepatitis A and typhoid if you have not already done so. Seek medical attention when you have fever which is more than 2 days, mild grade and all, or if it is a high grade, seek immediate medical attention. Do not investigate yourself. Do not pop in medicine yourself on your own except the paracetamol. Take care of yourself. Do not eat anything from outside. And wishing you a very happy monsoon 2023.